Hello, good morning. Now, today we are going to discuss the second largest bone of the face, which is maxilla. Here we can see there are two maxillas which articulate each other and helps in formation of the orbital, nasal, and oral cavity. Here we go for the surfaces of the maxilla, which are the orbital surface, or also call it as a superior surface. It is superior, so it's articulating with the orbital formation. So we will call it as a orbital surface or superior surface. And this is the posterior surface. Also, it is called as the infratemporal surface. Infratemporal surface. And this is median surface or nasal surface, and this is the anterior surface or frontal surface, the four surfaces of the maxilla. Now take a glance look of the maxilla. The two maxilla meet each other and it forms the nasal notch, and the maxilla is directed forwards and laterally. It's spreaded forwardly and laterally, and the muscle originated from the maxilla are from this incisive fossa. Here we can see the incisive fossa. From the incisive fossa, there are two muscles, the depressive septi, which originated from above the incisive fossa, and below the incisive fossa, the muscle is called as incisivus muscle. Incisivus muscle. And lateral to the canine eminence, there is a depression called as the canine fossa. The levator anguli oris muscle originated from the canine fossa, and above the canine fossa there is a foramina which is called as the infraorbital foramina, and it will pass the infraorbital nerve and vessels passes through this foramina. Above the foramina there is a margin, orbital margin, anterior orbital margin. Between the orbital margin and this foramina, there is one muscle will originate from this area, particularly this area. That is called as levator labii superioris. Levator labii superioris muscle. And now we talk about the posterior surface of the maxilla or infratemporal surface of the maxilla. It is convex and directed backwards and laterally. Now here we can see the infratemporal fossa. This is the infratemporal fossa. It forms the infratemporal surface forms the anterior wall of the infratemporal fossa. This is the infratemporal fossa and this is the anterior wall for that fossa. The posterior surface of the maxilla will form the anterior wall for the infratemporal fossa, and the rounded eminence we can see here, this is called as the maxillary tuberosity. This is located posterior inferiorly. It is the rounded eminence is called as maxillary tuberosity, and superior medially it articulates with the pyramidal process of the palatine bone, and it gives origin to the superior head of the medial pterygoid muscle. It will give origin to the superior head of the medial pterygoid muscle, and center of the posterior surface of the maxilla. Here we can see the 2 to 3 canals for the posterior superior alveolar nerve. For the posterior superior alveolar nerve, and here we can see the zygomatic. Here we can see the zygomatic process. It separates the anterior surface and the posterior surface. It descends downwards at the area of the first molar teeth. This is about the posterior surface. Now we can talk about the orbital surface of the maxilla. Here we can see it will forms the floor of the orbit. We can see this is the anterior border of the orbital surface of the maxilla. It forms the anterior margin of the orbit, and this is the posterior border, which helps in the formation of the anterior wall of inferior orbital fissure, and this is the medial border, and this is the medial border which articulate with the this is the lacrimal bone. There is a groove, there is a depression called as lacrimal. Here the lacrimal gland is present in the lacrimal bone, and this is the orbital surface of the maxilla articulate with the lacrimal bone. Here we can see this is a lacrimal bone, and behind that lacrimal bone there is a ethmoid. Bone, and the small presence of the orbital process of the palatal bone is also present. Here I can repeat once again, the orbital surface of the maxilla articulate with the lacrimal bone and the ethmoid bone and the palatal bone, the small piece of the palatal bone present, and here it articulates with the zygomatic bone. Here we can see this is the zygomatic bone. This is about the orbital surface of the maxillary bone. One more thing we missed in the previous video, that is, here we can see this one. This is the orbital groove which appears in this orbital process of the maxilla, which it opens here. The orbital groove passes the infraorbital nerves and vessels through this infraorbital foramina. This is the orbital groove, and this is infraorbital foramina. And the muscle which is originated from here, lateral to the lacrimal groove or lacrimal depression. Here, from here, one muscle will arise, that is inferior oblique muscle. Inferior oblique muscle of the eye arises from lateral to the lacrimal groove. It will originate from lateral part of the lacrimal groove. Here we can see this is the medial part, and this is the little bit lateral part of the groove. Here we discussed. Now come to the median. This is the median surface of the maxilla. The median surface of the maxilla also forms a lateral wall of the nose. It will form the lateral wall of the nose. There is a irregular opening in the posterior superiorly. There is a irregular opening. We can't see here, but I think we can see from there is a irregular opening here. We can see that is the opening of the maxillary sinus, that is called maxillary hiatus. The maxillary hiatus. Below the maxillary hiatus, there is a smooth surface which helps in the formation of the inferior nasal meatus. And anterior to the maxillary hiatus, the bone articulates with the ethmoid bone. Enclosing the nasolacrimal groove, and behind the hiatus the bone articulates with the perpendicular plate of the palatine bone, which encloses the greater palatine canal. The nerve passes from that canal are greater palatine nerves and anterior, middle, and posterior palatine nerves. This is what about the maxillary medial surface of the maxilla. And one more thing we missed about that medial surface of the maxilla. The thing is, more anteriorly it articulate with the bone, that is inferior nasal concha. We can see this is the inferior nasal concha. More anteriorly it articulates with the inferior nasal concha. Now I can tell once again the features of the medial process of the maxilla are: there is a posterior superiorly irregular opening called as maxillary opening of the maxillary sinus called as a maxillary hiatus. Behind the maxillary hiatus there is it articulate with the perpendicular plate of the palatine bone enclosing the canal, the palatine canal, which the nerve passes through that canal are greater palatine and anterior, middle, and posterior palatine nerves.